the United States is approaching a new pandemic trend. The hospitalization of children is soaring to a record high. According to data released by the U.S. government on Friday, there has been a rise in hospitalizations among children under the age of 5, the only group not eligible for vaccination. Speaking on which, Director of the Centers for Disease Control and Prevention, Dr. Rochelle Walensky, said that the worrisome trend in children too young to be vaccinated underscores the need for older kids and adults to get their shots to protect those around them. Since mid-December, as the highly contagious Omicron variant has spread furiously around the country, with the United States reporting record single-day infections, the hospitalization rate in these youngest children has surged to more than 4 in 100,000 youngsters, up from 2.5 per 100,000. Walensky pointed out that some unknown number of these cases are incidental, children who test positive when they are hospitalized for non-COVID reasons. Many of the case reports of children come from asymptomatic kids who enter the hospital for elective procedures or other illnesses, further complicating the picture for epidemiologists trying to figure out risks for children. Now, earlier in a White House briefing, the U.S.'s top infectious disease expert, Dr. Anthony Fauci, said many children hospitalized with COVID-19 have other health conditions that make them more susceptible to complications from the virus. That includes obesity, diabetes, and lung disease.
Okay, don't tense up. Stay loose. 1, 2, 3. You did great.
Now, for more on this, we are being joined by Dr. N.K. Arora, the chairman of the National Technical Advisory Group on Immunization from New Delhi. Now, welcome to you. Thank you for being with us. Firstly, is the Omicron variant affecting children more in the present waves of COVID-19?
After the subsidence of Delta wave, there were another concern that children may be more affected. And now again, when Omicron is coming. So we have been looking at Indian data very carefully, and we don't find any unusual sickness or positivity in children so far. And most of the Omicron infected adults are those more than 60 years and or those who have comorbidities like heart disease, blood pressure, diabetes, cancers. So, but we need to make vigil, and system is completely geared in case number of children who get sick due to Omicron, they will be taken care of very well.
Right, Doctor, the alarming surge in children being hospitalized, what does this mean for other countries as the numbers are increasing?
So as far as our concern is, our country is concerned, the numbers are increasing. And if we look at South Africa or Europe or North America, the way cases have increased, during last 1 week or 10 days, we have also seen a similar surge. And in a week's time, the number of cases have increased by 3 times. But I would say that it is a good observation that children are not affected to that extent disproportionately children are not affected in our settings. And I think globally this has relevance for across the country, global.
Now, do healthcare institutes need to tweak their facilities in providing support for children in hospitals?
Yes, as I told you, that across the country, every COVID facility has now facility for looking after pediatric patients. In fact, pediatric ICUs, pediatric oxygen beds, and pediatric ventilators have been set up across the country. And the pediatric beds have been increased several folds across the country. So we don't have any concern in case the children are becoming more sick. But at the moment, we have not seen any of that kind of trend. And I think across the low and middle income countries, a similar pattern is seen. Here, I would say that natural infection in our children is as much as in adults. About 80-85% of our children have already suffered natural infection because of the previous COVID variants. And that may also be provided some kind of a protection against any severe disease when new variants are coming.
Right, and also for the parents, how can they keep their children safe during these times? Are there any special precautions to be taken?
So I would say the COVID appropriate behavior is the most important thing. Mask, and children should keep away from crowded places. 2. And third is that although during last 1 or 2 weeks, a lot of schools have been closed, but I would suggest that parents should not get panicky. They should not get terrorized that because Omicron is highly infectious, it will be unduly affect them. No. But here, I think the most important thing for our parents is that all their children between the age of 15 and 18 should get immunized. And it is very heartening that during last 4 or 5 days, more than 2 crore children have been immunized. So my message to the parents is, don't be panicky, get your eligible children immunized and ensure that they adhere to COVID appropriate behavior. And keeping away from social gatherings is very important because that's the key for spread of infections.
Right, and finally on that, do you think then that vaccination for children should be increased?
No, vaccine. So we have prioritized the pediatric vaccination. As I told you, during last 2 years, our experience has been that most of the severe COVID patients in pediatric age group or children and unfortunate fatalities are in this age group of 15 to 18. So we want to complete the immunization of this particular age group and then stepwise start considering other age groups for immunization. And so the way we have taken up is a global best practice that prioritize the older children because 15 to 18 behave like adults and then gradually go down the age bands and give them the vaccines.
Doctor, thank you for joining us and all your valuable insights there.
WION, now available in your country. Download the app now. Get all the news on the move.